I'm stuck. And the amount was big because my house is in renovation. I wanted to buy certain things. So deposited, so purchased a gift card worth a big amount. So that entire money is stuck. So it's like the sixth day. They were purchased on 14th morning and today is 19th morning. Still nothing is resolved. So whether that gift card is worth of 500 rupees or if it is 1 lakh, it's the same thing. What error comes is, it's a very, very strange error. In error is something like this. Where you do it from your cell phone. This is on my cell phone. So it tells that please enter the CAPTCHA below to authenticate your action and securely view your gift card. But it happens like, see, you can see that no CAPTCHA is seen. You just can't see any CAPTCHA, nothing. So you are stuck. Nothing can be done.
So the money cannot be returned?
No. What say I contacted even the Pine Labs. Pine Labs, that is the company who is issuing all these, who is doing all these transactions on behalf of Amazon. So they are, though I should not use such bad word, but I received their 6 emails that kindly send the screenshot. And every time I'm sending the screenshot, they say message received and processed. And after 2 hours, once again, it will come up that thank you for contacting Amazon with respect to your complaint number. Now, I even remember the complaint number 288229477. And again, issue. नहीं यार, tariff issue से कुछ लेना देना नहीं है. Tariff तो it is like when something is going from India to US, so then those Indian products the tariff would be issued. This is so simple now. Amazon, even if I want to buy vegetables, to be this money can be used. This is the problem of transaction server. And today that officer, when she said that normally we don't disclose this thing, but it's not only your problem, and it's a big problem, and many customers are getting affected. Anyway, she promised that within 24 hours, I'll solve the problem personally. I said, fine. So let's see. Let's hope.
Good morning, sir.
Good morning. Today's session will be like a pleasure. It is like it. Only the images are there. Only images. So sorry for those emails. Say it is not very easy for me to prepare the diet chart, right? Because to make a diet chart, it's a long process. I don't wish to send you the wrong reply. Chalo, I just send you some standard diet chart. No, diet chart as such, it depends upon multiple factors, so many factors, so much so that in order to design the chart, you might have to I might have to check your DNA. You'll be surprised. DNA, yes. DNA, this is what is called as the gut, your gut health, which is related to DNA. So it is not like that, say, whey protein. If everyone is taking whey protein, you also start taking whey protein and you'll be getting the same results. No, there are some tests. These tests, they are like at a microscopic test. And to be very scientific, once you go through those tests, it costs you about 8,000-10,000 rupees. Anirudh Pathak, yes, about the notes, I think I have replied to you. I think you are the person who has brain mapped the lecture. You know? with different colors, if I'm not wrong. And I replied to yours. Okay, that's nice. It was good. Really good. Let me open the chat on that screen. Okay. Kulshri. This is due to how old we talked about. And that, yeah. I saw your notes also. Acha. So it's time. Shall we start? We start. Right. It's 5 minutes past 10. And that's time. So here is the muscles part 2. Now in this second part, we'll be going through almost the entire body. So many muscles. And the idea is that first we understand about the nomenclature, how the muscles are named. Because if today's session, if you understand it properly, like this, from where did it come? Ah, ignore this image. This is like a mystery because when I activated my graphic, because I rebooted the computer. So I started this program, but pen was not working because the drivers had to be installed. Install the driver, and those drivers, they behaved erratically, and now this image is not even going. Erase anyway and see how to manage. Right? In the final file, which will be saved into our shared folder, I'll remove this somehow. Or we can remove it right now. Let's see. That. Oh, it comes back again. चलो ठीक है. Can there be one solution? Just a second. This duplicate page. Page duplicated. On this page, it is not appearing here only. So let's delete this page. Delete is gone. So, oh, so. So I was talking about this nomenclature part. Yeah, Shiva. ये क्या भेजा है? So in Greek and Latin, these are the terminologies which will be used. The name, it will be based on either shape of the muscle, size of the muscle, fiber orientation, actions, number of head or bellies, attachments, and location. These are the various styles by which any of the muscle is named, right? What we'll do is, instead of remembering all these theory, we'll straight away watch several examples, and that is it, right? So here it is. First, let's start with the shape. Shape, deltoid. Deltoid or the delta. Delta means triangle, right? So it came from the word deltos. So the delta is triangle. So here is an example. This is deltoid muscle, right? This muscle, which is deltoid, triangular muscle. Triangular muscle. Today we'll not be going into the detail of that. There is anterior deltoid, there is lateral deltoid, and there is the posterior deltoid. But the thing is that if you really expand it, you'll find that this muscle is a triangular muscle, right? Triangular muscle. The specialty of triangle, obviously, very easy, that it will be having a big base and then it would be attached to a small point. So that entire pressure would be focused on that, and then from that point it will pull, right? So when it pulls up. So that is when you take your hand up. And whenever you do that, you'll be able to feel your deltoid, right? So the thing is, if the muscle is contracting, specific muscle is contracting, you'll be able to feel it, right? So this is deltoid. This is better. So that's first shape, right? Triangular. There is one more shape, the circular shape. And that is what is called as, when we say orbis, right? It came from the word orbit, that is round, right? Round, circle. So orbis or orbit is circular. So here we have got orbicularis oculi. The simple meaning is The muscle which is around the eyes, oculi, is eyes. The muscle which is circular and it is around the eyes. So that is called as the orbicularis oculi. Here it is, the zoomed version. Now, similarly, the muscles around the lips, so they are called as oris. Oris is oral cavity, mouth. Right? So this is oral cavity. So that is the orbicularis oris. Now there are several muscles in the face, but today, say we'll be going through all the regions. Our concept is understanding the name. And by the end of today's session, when you will be coming across any of the muscle now, with very simple language में मतलब ब्लफ करने में बड़ा मजा आता है. Many times you'll be right. गप्पा मारने में बड़ा मजा आता है because from the name you'll be able to say so much. यानी वाइवा में बहुत काम लगता है. So here it is, rhomboidus major and minor. Rhomboid, right? We know what is rhomboid. पता है ना, right?
Yes.
That's the parallelogram. So this means that this muscle will be having, मतलब जैसे किसी ने पूछा, just say something about rhomboidus major. Yes, this is a muscle, right? Whose shape is like a parallelogram and it has got 4 sides. Now, when the muscle has got 4 sides, so मसल कोई ऐसे थोड़ा होगा, मतलब ऐसा एंगल पे, मतलब इट विल बी सिचुएटेड इनटू द एब्डोमेन. नहीं, रोम्बोइडस मतलब तो most probably it would be in a very geometric proper fashion, right? So you can easily bluff that there is a medial edge, there is a lateral edge. When medial and lateral are there, so then there will be a superior surface and there will be an inferior surface. कौन सी बड़ी बात है, right? It has to be like that.
Sir, would it be on both the sides?
Yeah, it would be on both the sides. It will be on both the sides. That's right. Right? Most of the muscles are on both the sides because body is symmetrical. And एक बार देख लिया ना तो फिर तो क्या मस्त मजा आएगा गप्पे मारने में. गप्पे मतलब लॉजिकल गप्पे. कुंजल हंसो मत, सही बात है. मतलब दैट्स हाउ वी यूज टू अपीयर फॉर एनाटॉमी. मतलब एक्टिव पैसिव करके, पर वो सर बड़े स्मार्ट थे. मतलब शांति से आराम से सुनते थे. देन पूछते थे कि अच्छा जानी एनीथिंग एल्स. बस सब फंसते थे. And the killer question was, during our Viva, yeah, that was a killer question. Pick up the bone which you know the best, right? Put the pointer on the muscle which you know the best. बस फिर बकरी डब्बे में, क्योंकि तकलीफ ना, which you know the best. So here it is. मतलब ऐसे ऐसे भी बोलते थे. मतलब ये रोम्बोइडस इसलिए मुझे पता है कि मैंने कहा कि हाँ सर, देयर इज रोम्बोइडस मेजर, but because the nomenclature is like that, so there must be a rhomboidus minor also. That's why this muscle is called as rhomboidus major. Immediately he said, okay, show me rhomboidus minor. नहीं आया, पता ही नहीं था. So this is honestly what happened in the Viva. फिर सर ने दिखाया Viva में, ये है ना. कहा हाँ सर, this is also rhomboid. Right? So rhomboid is parallelogram. So major and minor simple. Major is always a bigger muscle, but if there is one other muscle which is very close to major and it is of smaller size, then it would always be called as minor. Examples: pectoralis major, pectoralis minor; psoas major, psoas minor; rhomboidus major, rhomboidus minor. This is the best thing. Major muscle, तो smaller muscle will always be just underneath. Psoas में भी ऐसा ही होगा, right? Its name is psoas, huh? Psoas. P is silent, right? So not the psoas. Okay, so here it is rhomboidus major, and by the way, this marking, right? That is for rhomboidus minor, right? Just over there. So you over here, see, this is rhomboidus major, right? You just cut the rhomboidus major from above and just underneath. Here it is. Here it is the rhomboidus minor. Here up. Yeah. That's the rhomboidus minor. Same thing will occur in pectoralis major and minor. We'll just see that thing in a minute. So this is rhomboids minor. Then platysma. Plateau. Plateaus means something which is flat and wide. So it makes sense, right? So here is the platysma. Platysma is the most superficial subcutaneous muscle which covers the entire neck, right? So in all those superheroes के जब ऐसे गुस्से होते हैं तो ये पूरा जो shape बनता है, that is thanks to platysma, right? So this is a muscle which literally covers the entire neck. So during dissection also, when you'll be cutting it, right, when you'll remove the skin subcutaneous fascia, so this muscle that would be eliminated, removed along with it, because it is a very thin muscle, but its main function is to expression. So that is platysma. Name is flat and wide, so that's why plat is. Here it is. Serratus means ऐसे छुरी जैसे जिसके अंदर मतलब with ridges. This is called serrations, right? We call now as a serrations.
Sir,
हाँ,
even the suture had this name.
yeah, we have the suture. शाबाश, right? Sutures में भी था. Yes. So now what I have done is all the muscles removed, only that particular muscle is seen. So now when you see this muscle, so it looks like churi, right? Serrations. This is serrations. Now we apply our बिल्कुल सीधा साधा लॉजिक. सीरेटस एंटीरियर, तो सीरेटस पोस्टीरियर होना चाहिए ना, है, राइट, है. So that's how we say the names. That if there is serratus anterior, so there has to be serratus posterior. नहीं तो उसका नाम ही क्यों लेते? We would have said serratus, right? So this is serratus anterior. So serrare means saw, re, just to cut. Now the second one. Now the second concept. The first concept was of shape. The second concept is of size. So here either we'll be telling that this muscle is very big, or we'll say this muscle is very small, or we'll say this muscle is in between, right? So the word is vast. The name itself, vast. Vast means big, right? So here it is, because Latin word vastus, so vastus is big. These muscles, they will definitely be big. Up, this is the thigh. What we are watching is in thigh there are four muscles. Now do you know even the names of this: vastus lateralis, vastus medialis, vastus intermedius, and the rectus femoris, right? But we have removed the rectus femoris. We are just watching three vasti. From the location, yes, this was also into the nomenclature, right? Remember, right?
Yes.
That if there was one
Yes, sir.
point was of location. So here it is muscle which is big and on the lateral side, vastus lateralis, muscle which is on the medial side and it is big, it is vastus medialis, and in between muscles, intermedius, right? But it is also big, so that's why vastus is common. So here is the vastus medialis, intermediate, and the there it is. So wait, the pen bit thicker. Now it will be good. Yeah. So here, and right. So this is medial line. So vastus medialis. This is vastus lateralis, and this is vastus intermedialis. Lateralis, medialis, and intermedius. There it is. Pectoralis major, right? Pectoralis major. Just underneath the pectoralis major, there is pectoralis minor. So on this side, right, this side I have removed the pectoralis major so that we can see the pectoralis minor also. But look at the shape, right? This is also like a triangular muscle and connected at one point, right? Same way over here, this entire big muscle but connected at just one point. So that's why it is. Oh, perhaps it is from Amazon. Just hold on. एक मिनट के लिए. Just उनका नमस्ते सर, मैं चॉइस इंडिया ब्रोकिंग फर्म से बोल रहा हूँ. Not interested. So this is pectoralis major and pectoralis minor.
कोराकोइड को जॉइंट करता है.
हाँ, आपने कुछ कहा कि someone said something?
Pectoralis minor is joined to coracoid, right?
हाँ, that's right. Very good. Very good.
And to cartilage or to the bone of costal region.
Bone. Because these are some very powerful muscles. Though its name is pectoralis minor, but as such the muscle is powerful. So attachments they are on the bone. Even
Does
over
it
here
have
also.
white fibers more or red ones? Because it is something like that. No? White muscle fibers are more strength driven and red are less strength driven.
See, as such, if you see the attachments which are on the bone now, they'll be taking the maximum load. They'll be taking the maximum load, as we'll see in more detail. But they'll be taking the maximum load, so you'll find that they will be attached on the bony surfaces. Achha. Over here, again from the size, right? So we have got this gluteus means hip region. So this is the back side which is seen. Right? So this is the gluteus maximus. This is the muscle which actually gives shape to the hips, gluteus maximus. Then when you remove the gluteus maximus in this region, here if you see we have cut the maximus. So just underneath you come across this next muscle, and that is the gluteus medius. And this is the medius. This is the minimus, which is the deepest. So here it is the minimus. And gluteus medius is in between. Here it is. Gluteus medius, this is minimus. Right? So this is gluteus maximus, gluteus medius, and this is gluteus minimus. So that is how they all are arranged. The next one, like in this example, if you see, this is having such name which is comprising of so many qualities. Right now we are picking up minimi. Minimi means it is the minimals, the little finger. So we say this muscle is minimi. But what is it doing? It is doing flexion. Right? Flexion of a small digit is flexor digiti minimi. So here is this muscle, right? This is the little finger, right? That's the little finger, this one, and this is doing the flexion. So it means where would it be? Well, flexion is this. So that's why this will be on the palmar surface. This will be on the palmar surface. Because when we'll be looking at the muscles individually, so on the posterior side also we'll be watching on the bones. Right? If you remove all the cartilages, if you remove all the muscles, all the ligaments, so then the structure would look very similar. But when it is flexor digiti minimi, right? So it will be on the palmar surface. On the back surface, all the muscles which will be over here, they'll be for the extension.
Extension.
Right? So this is the FDM, flexor digiti minimi. Now here it is. This is a wonderful muscle of the neck. Capitis means towards the head. Right? Capitis means towards the head. So this is a long muscle going towards the head all the way, right? See the things, right? It is coming so deep. And then all the way it is going up. So that's why this is called as longus capitis. Longus capitis, and it is very near to the vertebra, right? Very near to the vertebra. So these muscles are pretty interesting. Now see, these muscles, they are on both the sides, right? So when it contracts, only one side contracts, so head will rotate on that side. When it will contract on the opposite side, the head will rotate on the opposite side. Correct? But when both of them will contract, so head will contract or move. It will move down, right? So this will be very crucial, especially when you will be discussing the functions, right? That what are the functions? So that becomes the important part. So that is longus capitis. Now here is another muscle. This is becoming now more and more interesting. You remember we talked about intrinsic muscles and the extrinsic muscles.
Yes.
And we said that intrinsic muscle is, it is starting into that region and ending in that region. So here it is. This is a wrist, right? This is so from here onwards, this entire thing is palm. The muscle which is in focus is this. Now this is, because it is head, so we call it that this muscle is related to thumb, so we'll call it pollicis, right? Pollicis. It is doing abduction. Abduction was taking away, right? So this is doing abduction. So that's why we call it abductor pollicis, right? Abductor pollicis. But there is one more muscle which is for abduction. So we need to give the name. Let's check. So we check and we find that one muscle is long and another muscle is short, right? So let's call this muscle, so we call it abductor pollicis longus, because this muscle is a long muscle. So that means there is some short muscle also. Yes, there is a short muscle which is just underneath. And because it is short, so we'll be calling it brevis. Abductor pollicis brevis. So in learning just one name, and we know that this particular muscle, which is doing the abduction of the thumb, and there is one long muscle, there is one short muscle. So both of them, they are working for this function. Long muscle, when it is a long muscle, so it will be doing the function of, I mean, so when it is a long muscle, right? So it will be working very powerfully. So then what's the purpose of short muscle? Short muscle is for finer adjustments, right? Because it is a short muscle, so it will be going for finer adjustment. Final movement, it is combination of everything, right? So that is intrinsic. Now, here there is another muscle, right? So when we see this muscle, so you'll find that, say, there is extensor muscle, right? There is a posterior compartment and it is for extension. So the muscle which is coming from other region and then landing over here, so they are called as the extensors. The extrinsic muscle. Now comes very important part, and this is the fiber orientation. Muscle fibers, they are oriented in which way? One, the transversely arranged, right? When the muscles, when they are transversely arranged, we call it transverse abdominis, because it is for abdomen and these fibers are arranged transversely, right? So we call it transverse abdominis. So any other direction available? Yes, there is another direction available when the muscles are oblique, right? The fibers are oblique. So here it is, we call it external oblique. Oblique is okay, but why external? Because there must be internal also.
Internal.
That's right. So here its full name would be external oblique, which is for abdomen, or you can add abdominis. But then as we are telling external, so there must be some internal oblique abdominis also, and it is there. However, in case of transverse abdominis, we have not mentioned anything like external, internal, superior, inferior, nothing, because there is only one muscle which is as a transversely, right? So that's why there will be, now we know that abdomen will be covered by three group of muscles: internal oblique, external oblique, and transverse abdominis. Right? So these are the muscles which we'll be dealing with. Now, as we are discussing this, when it will come to this lower region, this region, right, as the junction between abdomen and pelvis, there is one canal which is called as the inguinal canal, right? It is called as the inguinal canal. Whether anatomy or surgery, right, this inguinal canal will be playing a major role into your exam. inguinal canal, that is where these muscles, they just roll. They just roll and they become like a cord. But this cord is empty in between. So it is like it is making a tunnel. That's why it is inguinal. Inguinal hernia is inguinal canal, right? So when the structures, so this is like a potential weakness. Potential weakness means normally nothing would happen. But when the person is lifting weights unnecessarily high, when the abdominal muscles, they are not very tight, that's the reason in gym, people wear those belts because they want to keep this thing pressed. Right? But when you lift very heavy weight, so then these muscles, that is the area of potential weakness, they give way, and the abdominal structures, that is the intestines, they start traveling. When they are traveling through this inguinal canal, so it is called as indirect hernia. When they straight away try to come out, that is called as the direct hernia. So this is the indirect and this is the direct hernia. Right? This is one of the important condition. And then if it is strangulated, or if there is a blood vessel, or there is intestine whose blood vessel is compromised, so all those things, they become like emergency treatment. But this is what really happens. But will it be case only when there is lifting of heavy weight? No, someone who is coughing non-stop. Chronic cough. So when the chronic cough, whenever you cough, whenever someone vomits, right, so there is raised intra-abdominal pressure. When that pressure is increased, it gives problem. Right? So gradually, this is like a chronic thing. So gradually it starts giving more and more pressure, and the hernia occurs. That's why history will be very vital whenever you are dealing with a case of hernia. Right? In last question, it was asked, is hernia reducible? Yes, it is reducible. Definitely it is reducible. So you can reduce it, but because this defect is not repaired, so it will reappear. So it will reappear. Here it is. This is rectus abdominis. This is rectus abdominis. So rectus means straight. Right? Rectus means straight. So rectus abdominis, this is the muscle which is the anterior most muscle, and this muscle is absolutely flat. But this muscle is having several tendinous sheets in between. Here, here. So when we say six-pack abs, six-pack means everyone has got six packs. Everyone has got six packs or eight packs. Packs is nothing but these ridges. Now they are seen if person is having less fat. If the fat,
Sir, a doubt. Sir, Arnold had 4, right? There was something case like that.
this is what I'm telling. Six-pack and eight packs, right? When they say six-pack or eight packs, so it depends upon this ridge.
Sir, and it is completely genetics.
Completely genetic. So if you are having six packs, you can never make eight packs. What really happens is that this is covered by skin. But because our samosas and then pav bhaji and this all, right, all those things, they are in between. So that is the subcutaneous fat, and that subcutaneous fat is absolutely hiding this entire thing, right? Otherwise, if someone is 120 kilo ka hai, to bhi he can always boast, ke paas mere bhi six packs hain, but they are hidden, right? Main shobhaji nahi karna chahta, isliye they are hidden. So otherwise, everyone has.
That's what I say, sir.
Huh. But it's not a good thing.
Very little fat is always okay.
Little fat is always okay.
Emergency storage for immunity system.
वही तो. Because क्या पता कब सहारा के डेजर्ट में जाना पड़ जाए. So the point is this consistency. So developing six packs is not a big thing. It is just it can be done only with the help of diet, not by exercise. Again, I'm telling you that even if you do 1,000 crunches a day, na, to be six packs nahi aayenge. You need to cut down the fat, right? Fat percentage should be reduced, and in order to reduce the fat percentage, maje ki baat, you have to cut down carbs. You have to cut down carbs. Cut the carbs. So that body has got no other option but to call the fat. And at the same time, you'll be using that exercise which is into zone 2. Because if you shift to zone 3 or zone 4, body will say, do hell with the fat. Fat to dheere dheere energy deti hai. I need immediate, so that's why it will start breaking the muscles. Right? Because muscles, they give instant energy. Protein breaks, it gives instant energy. So that's why if someone is doing very hardcore exercise, so in that case, after some time, they start losing the muscle. And then they'll say, कि इतनी मेहनत करते हैं, but muscles नहीं बन रहे. The reason behind it is this. You are doing exercise, there is micro injury, body is requiring, body is demanding that I need to repair it. But then once again you are doing the exercise, the body will say, ठीक है, it is necessary to save the brain and the heart. So muscles break, take the protein, and it is generated from it. But when you are in zone 2, so in zone 2, there is no emergency. That's why it is said that if you go for a brisk walk means the speed should be more than 6 kilometers an hour. More than 6. So that means 10 minutes a kilometer. 10 minutes a kilometer.
Sir, what's the heart rate range in that zone?
Very
I mean,
simple.
zone 2?
Very simple. You need to go for this is 220 minus your age, right? 220 minus your age. Let's say in your case 20, right? Roughly, you might be 19, but for calculation's sake, 200, and then 60 to 65%. So that will come to 120 to 130 beats per minute. You keep your this heart rate. This is what is called as the fat burning zone. Right now, as your cardiac efficiency would improve, I think what is called as the VO2 max. This is one of the very important parameters. VO2 max. VO2 max means you are breathing, heart rate is increasing. That's okay, right? Heart is increasing, but heart is dependent on what? Heart is governed by the brain. It is the brain who is telling that no, I am not getting enough oxygen. Chal heart, beat fast. Why it is not telling lungs? Lungs के लिए तो उसने default छोड़ के रखा है कि boss, you will be absorbing maximum oxygen whatsoever is available, right? So even at rest, lungs will function sincerely to absorb whatever the oxygen which is coming. So when you are at rest, heart is beating slowly. Oxygen is coming, right? It is absorbing. Now you are running. तो heart rate increases because more blood is pushed to the lungs. Lungs ने तो वही सारा oxygen उठा उठा के blood में फेंकना है. VO2 max is that number which tells that whatever you breathe, but how, at what percentage of oxygen is getting absorbed and it is really pushed into the blood so that it can be utilized through and through. This is something which is more important, right? VO2 max के बारे में अभी ज़्यादा नहीं जाएंगे because it will take so much of time because VO2 max, it changes from activity to activity. Let's say my VO2 max is high when I'm running, but my VO2 max might not be very high when I am swimming or when I am cycling. But if I continue to swim for a longer duration, gradually my VO2 max would also improve in the swimming. Now these watches, right? These watches, what they do is they give you a general VO2 max count. They don't understand that on which activity it is changing, right? They give you general. So that's why understanding of VO2 max is so crucial. इसलिए तो कहते हैं you need to cheat your body, cheat your muscles. If you really want to increase your stamina, endurance, and strength, you need to cheat your body. So not the same exercise every time. Same muscle group is fine, right? But the compound it with some different exercises. So that's what is really needed. And when I claim this, give me 100 days, flat 100 days, right? On 100 day, you'll be able to run a full marathon of 42.195 kilometers in stipulated time, because there is always a cutoff. If you cross that cutoff, then you don't get anything, right? No one can. So you'll be able to complete respectfully within that cutoff time, just the training of 100, considering you have never ran even a single marathon. Still, it's a matter of 100 days. So that's why it is a matter of how you practice. That's why it varies from person to person. In our group, say I take the runners with me, but those who are say absolutely new, so I tell them कि आप एक काम करो, 5 round मारो ground के at your own pace and just Then we check that what is their MHR, maximum heart rate, how much have they reached. And then according to age, we calculate. And then the food is defined. What food they should really take. Because some food, say I gave you one example, right? If you can take it, I'm writing spirulina. इतना गंदा टेस्ट पर मुझे गाली मत देना, right? Spirulina 500 550 का डब्बा आता है. It lasts for about 45 days.
The
Right? So,
algae tablets, right?
टैबलेट में मजा नहीं है, वो पाउडर. द रीजन इसके टैबलेट का जो कोटिंग है, इट विल गो इनटू द स्टमक में आगे जाके फिर वो एब्जॉर्ब होता है, एंड देन द प्रोसेस एंड देन लिवर हैज टू कम इनटू पिक्चर. स्पाइरुलिना इफ टेकन इनटू द फॉर्म ऑफ पाउडर, राइट, पानी में डाल के नाक बंद करके आंख बंद करके पी जाओ, एम्प्टी स्टमक, and see what happens on few days. For first few 2-3 days, so you'll feel like that it is like you have to visit washroom again and again, but it is clearing all that kachra from the intestines. It acts like a jhadu, right? You'll feel the difference that you are getting lighter, and then continue taking it and see what happens when you check your hemoglobin. And beta कोई एक था, मतलब that girl, right? अब क्या कर रहे हो? Your hemoglobin was less than 8. Then there was one another Manubhav, D3 was less than 6. It's a crime. और बाहर का खाती हो तो बंद करो, इतना बोलने के बाद भी. चलो अच्छा है, at least you went for those blood test, right? I think I have not replied to you because there were so many problems in those. Your HDL was low. I remember HDL was in 30s, right? This is H for healthy. So unless until you do the exercise, proper exercise, आपका HDL नहीं बढ़ेगा. It should be high. LDL is lousy, खराब है. It should be low, right? All those triglycerides and everything. So they were all haywire. Very important. The creatinine clearance was so low. That means क्या इतना पानी नहीं पीती, right? So kidneys बिचारी क्या करे? But kidneys, they will say that there is no water. So in order to clear the toxins, right, I'll try to do my best. But otherwise, when a level is reached, those toxins, they will keep on circulating into the blood. What's the fun? Right? So do take care. Your simple hydration, right, that is very vital. On to the next one. So this is regarding practice. So here is one more. This is transversus. Transversus linguae. Lingua or the lingual, that means tongue. So this is the transverse muscle in the tongue. Just this is the second group of muscle, which are longitudinal, which are like this, and this is transverse muscle, which are arranged like this. So that's why these muscles, they are named like this. Transverse is lingual, they are transverse.
Sir, whole tongue is a muscle or tongue is controlled by muscles?
Whole tongue is a muscle, right? Tongue to puri tongue jo muscles hi hai, but the specialty of the tongue is that it is covered by a skin, and that skin, it has got so many sensors, all type of different sensors, which are for taste, touch, right? So many sensors. So that's why tongue is one of the very important component, because it is like a first line of defense. It has got tremendous temperature sensor, because if anything is very hot, so yahin se body would reject and throw it out, because otherwise it will go inside. So then there is no way it can be really be taken out, right? So that's why this is, if kuch bahut tikha khana hai, right? So it would be rejected from here only. So that's why tongue, those taste buds, they play a very major role. कुछ खाना अच्छा नहीं लगा तो immediately there'll be a gagging reflex. Whoop, bar, right? Body is not accepting it.
So even carbs are 30% digested there only, na? In mouth.
Carbs, proteins are digested. Even saliva.
Saliva
Has got the proteolytic enzymes, so they are digested. इसीलिए तो कहते हैं, there is one very superb thing. I mean, it is so powerful, so effective. Drink your food, right? It is like drink your food. कैसे? chew
Sir,
30
but it
times.
doesn't sound right nor feels right to chew
अरे
that much
दिमाग
time.
खराब हो जाता है, मतलब बोलने में अभी भाषण देना हो तो बहुत अच्छा है यार। मैं इस पे 2 घंटे बोल दूं, राइट, ये होता है वो होता है, प्रोटियोलिटिक एंजाइम दे मिक्स, अरे पर करने बैठो तो वो दिमाग का एक हो जाता है, राइट। एंड देन ये दिस इज पॉसिबल, एंड ईट योर ड्रिंक और वाटर, राइट, ईट योर वाटर, ये ठीक है, मतलब यू जस्ट कम इनटू द रोल ऑफ अकबर बादशाह, राइट, जलालुद्दीन अकबर, राइट, तो देन ड्रिंक द वाटर इन स्टाइल, धीरे धीरे एक एक सिप करके, सो दैट इज ओके।
Even the taste gets bad after that much chewing.
टेस्ट तो कुछ नहीं
Not
होता, पर
bad,
वो
but
पेशेंस यार,
plain.
पेशेंस, अगर जो किसी के साथ गए हैं तो यार सामने वाला खड़ा होके चला जाए कि बिल तू भरना, तो वो आप अभी भी खा रहे हैं धीरे धीरे। हाँ सही। अच्छा, चलो, now we are watching the eyeball. This is eyeball. This is eyeball. And what we have done is we have removed the plate, right? This is like the ये पूरा just for the orientation. That's the skull, right? These are the eyeballs. So we first cut it like this. So that scalp is removed, right? The total skull cap is removed. So when the skull cap is removed, so now we are watching this, right? So we are watching from the top. When we are watching from the top, so this will be the bone. This will all be the bone, right? So we just broke the portion. यहाँ पे इतना portion तोड़ा, so that we can watch the eyeballs directly. So here is the eyeball, right? This one is the eyeball. Now eyeball is controlled by 6 muscles. 4 rectus, right? So that means they are straight muscles. Yes, they are straight muscles. Here it is, a straight muscle, right? So this is a straight muscle, which is exactly on the top, right? This is a straight muscle which is on the side. This is a straight muscle which is on the other side. There is one other straight muscle which is just below. So I can say it like, if we watch the eyeball from front, this is front view. Front view. So there'll be superior rectus, which is on the top. There'll be inferior rectus. There'll be medial rectus, and there'll be lateral rectus. And by this time, so you are very well about that rectus means straight, correct? So rectus means straight. So here is what we are watching is superior rectus. So these are the 4 recti, right? Superior, medial, lateral, and inferior. Plus there are 2 obliques. 2 obliques. So they are running at an angle. They are running at an angle. So we'll be calling them superior oblique and inferior oblique. Superior oblique and inferior oblique. So that's how they really go, right? 4 rectus and 2 obliques. Now we move on to the actions. So this is, we are dealing with the foot. And in the foot, this big toe is called as the hallucis, right? The way this thumb was called as the pollicis, this is called as the hallucis. There is one muscle. So when that's your foot, when you do like this is called as flexion. When you do like this, it is called as extension. So flexion. So if it is flexion, so once again, this is the surface of sole, right? This is sole. So then it will contract and it will do it like this. So here we are watching it from beneath, underneath. And here is flexor hallucis. Perfect. Flexor hallucis, right? Flexor hallucis. So this is the flexion of the big toe. But then brevis, that means there must be longus also. Yes, there is. There is. So this is a short muscle. That's why flexor hallucis brevis, a short muscle. Brevis. Now this is one more muscle. It is extensor. Extensor, that simply it will be on the opposite side. Okay, opposite side. So that it will,
This is extrinsic muscle.
this is extrinsic muscle, no doubt about it. Sure. And digiti, it is going for that small finger, extensor digiti minimi. So this is the muscle. So this is the flexion. But now when you do the action of this, so that is the muscle which is coming into action. Extensor digiti minimi. Extensor digiti minimi.
Sir, a very, good question actually. Why such big muscle is needed to for extension of the pinky finger?
Reason that we have got, say, the muscles which are on the flexion, right? Flexion and extension. When you keep your hand like this, so it is like a wonderful balance. Right? As such, flexors are always powerful, right? Because this with power with which you can grip is always more as compared to the extension. Right?
Mm-hmm.
So flexors are powerful, but to keep the hand in exactly central position. So what is happening right now? Flexors are telling that we want to flex, but extensors are telling no, we want to keep the hand in our side. So it is the wonderful balance. Now there are more flexor muscles and there are less of the extensor muscle. So extensor muscle has to cancel out the movement of flexor. This is the concept of what would be the hand position in many of the diseases. So that's why whenever there is extensor palsy. The nerve supply of the extensor is at stake. Something wrong has happened and extensor are not getting the supply.
Fingers are curled always.
Yes, fingers will be like. So this is what is called as the wrist drop. Wrist drop is not the fault of these flexors. Flexors so कह रहे हैं कि भाई we are doing our own work. But वो साला extension he is unable to lift it back. तो thak. This is what is called as the wrist drop. Correct. So that is how it happens. Similarly, there would be say internal rotation and there'll be external rotation. Both of them they are working. So we'll see it in brachial plexus, Orb's palsy. Orb's palsy. So in that case, right, the hand is rotated inside, right? It comes near, and the wrist is like this, right? All because of imbalance. The outer muscle, the muscles which are going for the external rotation, they are paralyzed. So inward rotations, they have become more prominent, right? They are working normally and they rotate it inside. So that's what is called as. So that's how it goes.
Imbalance occurs if the extensors are not
Imbalance.
that
Yes,
powerful. Okay.
imbalance. Exactly, imbalance. Acha. We were talking about this. One of the most interesting movements, supinator and pronation. So when we do supination, so it is like this, right? It is like this, and pronation, it is like this. For this movement to occur, it is the radius and ulna, right? They are coming into picture. So just take your hand, and if you want to do the pronation, what you'll do? One muscle connected on one side and second, and it is rotating the one bone over the another. And then there is a reverse muscle which will be taking it back. Here it is. Supinator, from the prone position, it will pull and it will do it like this. Supination, right? So supinators, they supine, the final position will be supination, and pronation, the final position will be the prone position. Now, see, here it is, pronator teres. Pronator teres. Now, new word has come up, teres. Kyun? Teres means something which is short and round, right? Which is a very small muscle. It is short and round. So there must be a big muscle also. Yes, there is, right? So this is the function. When these angular muscles, when it is connected to radius and ulna, so one bone will be fixed and it will pull the other bone. When it will pull the other bone, so hand has to rotate, right? So this is pronation. When it is the other way around, when it pulls like this, so it will be supination. So pronator, and don't worry, in upper limb, so we'll be learning every muscle individually, along with the dissection. Acha. This is a muscle which is very nice, right? This should be your favorite muscle. This muscle is risorius. Ab logic देखो. It is connected at the end of the lips, right? So risus means smile or laugh. So when these muscles contract, right? Obviously ये बेचारा मरा हुआ है, फिर भी, right? He is attempting to smile. So this is the muscle for smile, right? This is the risorius, this muscle, very small muscle. This is the risorius. Now, you know, when they say कि when someone smiles, तो वो heroine होती है या तो कहते हैं कि वो there are small dimples, right, when they smile, which is considered as absolutely a beautiful thing.
Many people think the deficiency.
अरे नहीं डेफिशिएंसी उसमें कुछ हो नहीं सकता मतलब दिस इज लाइक द रिसोरियस आर शॉर्ट राइट सो कुछ नहीं हो सकता रिसोरियस शॉर्ट है तो व्हेन इट कॉन्ट्रैक्ट्स सो इट कॉन्ट्रैक्ट्स एंड इट क्रिएट्स लाइक अ गैप सो दैट खड्डा इन अपने उस पे पीड़ा हो जाते बट व्हेन वी थिंक एनाटॉमिकली तो देन वी से कह रहे जाने दे राइट माय रिसोरियस इज बिगर देन यू सो दिस इज द थिंग दिस इज द रिसोरियस व्हिच इज फॉर स्माइल its importance इतने सारे क्वेश्चंस वेट फटाफट आई टेक हाँ 2 घंटे लगते हैं खाते खाते यू मस्ट बी डूइंग इट हाँ फ्लेक्सिबल स्पेस फूड हाँ dimples are connected to this. That's right. But only on one side, both sides. Those yes, pectoralis major and pectoralis minor. They are on the both sides. The entire chest which is developed that is because of the pectoralis major, right? It is because of the pectoralis major. And one of the important thing is, say in case of female, there the beauty of the breast. So much of work has been done on that. Right? That depends very much upon the power of the pectoralis major because the entire mammary gland tissues they are on that. So if some of the exercises if they are not done gradually, right, pata bhi nahi chalta, as the age increases, as they reach to the age of 30, then suddenly there will be sagging, which is called as the sagging of the mammary gland or the breast tissues. And when that thing occurs, it becomes very difficult to go back. And then comes the silicone implants and this and that, all sorts of nata, right? Which is never advisable. But say it's like a natural process, natural aging process. But why not to do certain exercise so that you remain in best of your shape as much as possible, right? There was one Hollywood heroine, Raquel Welch. You won't be able to guess her age. First time when I saw her photo, right, I guessed that she must be 30, 35. When I Googled, 68. Imagine, this is the thing. Acha, when testicles are protruded back through the umbilical is a type of hernia. Well, it's usually, that is called as the torsion. It is other way around also. There is what is called as the hydrocele. Hydrocele, via that canal, the fluid enters into the testicles, right? So that there is enlarged testicles filled with fluid. So in that case, that entire scrotum is filled. So testes are there and the scrotum is filled with the fluid.
There's so many coaches or they advise not to wear tight inners while doing heavy exercises.
Very right. Now that is I'm so glad that you know about this. Wearing very tight jeans, right? That leads to increase in temperature of the testes. Increase in the temperature of testes will lead to decrease in the quality of those sperms, right? Many of the sperms, they will be immature, they will die, right? And an entire cycle is affected. And this is one of the prime reason that now in the age of, by the time people reach to the age of 35, you'll find that they find it difficult to conceive. Stress is one of the factors because there is so much of competition, right? Bas mein paisa kamau, main ye karu, wo karu. And in that process, their sympathetic system is always on fire. When
Sleep also disturbs the thing, right?
Yes, very much. So stress, sleep. Stress is something, if the sympathetic is firing, so then parasympathetic has got no chance. Parasympathetic is what? Rest and digest. Must the cow. My father used to teach me कि खाने के बाद सो जाओ और मारने के बाद भाग जाओ, उससे सुखी जिंदगी में कभी नहीं होगे. मतलब किसी को मारना था, मार लिया और भाग गए, फिर झगड़ते रहो, राइट? पर हमेशा खुश रहोगे. सो मतलब ऐसा करना मत. हाँ, but definitely after your food, it is not advisable to go to sleep immediately after dinner. Right after dinner, you walk for some time so that at least stomach is emptied, and then you go to sleep. Quality of sleep is surely more important than the quantity. Quality of sleep. So we'll take. Yes, I got those emails also regarding the sleep. One full session on sleep types, and how to improve the sleep quality. We'll surely take that, right? And take it on high priority. Within next month, we'll take this topic. On any of the Saturdays, we'll take.
Sir, before ending today's class, can you just give 2 or 3 exercises for core muscles, like
Sure.
whole, not only crunches, because it trains just 2 types of muscles,
I'll
right?
I'll tell you one exercise only. You do it, and you'll feel so good. You'll feel so good. You'll feel
Plank.
something. Plank is okay. Plank nahi. This is like sumo squat.
Okay, okay.
Sumo squat, and that also you need to go for imbalanced sumo squats. Right? I'll explain. Just remind me. What is the
Okay.
importance of roughage? Roughage is, it gives 0 calories. Roughage is 0 calories, but at the same time, it helps in the formation of bulk of the stool, right? So that you don't have to sit in washroom for extended period of time.
Plain water has more of its.
Absolutely. I want to take a blood test. Which one I should? Your name is good, Rugved. B3 and B12, right? These are the two important things for a medical student. But as such, if you are going for the test, just go for the entire body profile. It would cost you something, but you can go for that because it will act like a baseline. Let's say your hemoglobin is 15.7, right? And after 6 months, 1 year, you are go for the test, and if it turns out to be 14.4, so then there is something wrong. Either you are not eating properly, or there is some occult bleeding. So that is what you can judge. This is called as the baseline. So always store your blood reports. Very important, right? It will help you in diagnosing so many conditions at a later stage. Orbicularis, oculars, हाँ यहाँ पे भी सब दिख रहे हैं because muscles तो they are. Oh, you have the dimple. Whisker dimple. Wait. Risorius is such a muscle because now the cosmetic surgeries are getting done. The natural dimples, they are beautiful, but after cosmetic surgery, there was one heroine, funny, Mamta Kulkarni. She went for it, and after that, she was looking so gorgeous previously, and then after surgery, if you see, somehow she went for this risorius shortening, right? Then to the smile was looking like they say Akashwani hogi, ha, that sort of. Well, her face was looking so dangerous.
Sir, I have original dimple.
I agree.
सर वन साइडेड डिंपल में लाइक एक ही साइड शॉर्टन होता है क्या?
पॉसिबल है, हो सकता है, हो सकता है.
क्योंकि मेरे को वन साइडेड डिंपल है.
See, Daksha, the thing is, not you. अपने यहाँ जितने भी बैठे हैं ना, 99% will be having imbalance. In very rarest of the rarest case, it happens like that both the sides are absolutely balanced. Otherwise, वो plus minus तो थोड़ा होता है, and that's the beauty. That's
I
the
have both sides, sir.
then you are a rarity, Radhika. So on to the next one. This is adductor pollicis. Adductor, right? It is coming near. Adductor, pollicis is thumb. Adductor pollicis. कुछ नहीं. Adductor pollicis, longus brevis, ये वो कुछ नहीं, because there is only one muscle. So this is adductor pollicis, right? But then the smart thing about it is that this adductor pollicis, it has got several components, right? This is when we'll be discussing these muscles at length. We'll find that there are longitudinal fibers, there are transverse fibers. So एक ही मसल पर अच्छा एक नाम दिया पर उसके अलग अलग different type of fibers, and those fibers, they are having different function. That is when the adduction is done at what angle. So it is like initial start will be with the long muscles, transverse muscles, and those short muscles, they will be taking part at a later stage when we really want to push the finger deep, right? You know that gripper, अपने gripper से exercise करते हैं, right?
Yes, sir.
Yes,
So
sir.
it is for all these muscles, because when you shake hand, right? So then that shaking of the hand, it is not so that जिम में जा रहे हैं तो सामने वाले का हाथ क्रश ही कर देना है, तोड़ ही देना है, right? Fracture, नहीं. But your hand should be firm. Your hand should be firm, right? I'm not telling you should crush, because this is a habit of many of the males कि जानबूझ के मतलब उसका हाथ क्रश ही कर देंगे. नहीं, don't let it crush. And there is one trick also by which सामने वाला कितना भी powerful हो, they won't be able to crush your hand, right? It is what is called as the long finger. So when you say shake hand, right, what you have to do is your thumb should rotate, and wherever his long finger is at the root, just keep it pressed. He won't be able to crush your hand, right? Unless and until he is Arnold Schwarzenegger, whose strength is 20 times more than you, वो बात अलग हो गई. But routinely, no one will be able to say mess with you very easily. And whenever possible, right? Box breaths, right? You just put all those fingers and then try to do even 1 or 2 push-ups. 1 push-up to bhi chalega. Bruce Lee used to do it with 1 hand and only on thumb, right? That is too far-fetched. Don't try it, because agar jo slip hua, so this thumb will break. In movies they show, but very, very few people, they can actually do it. And those who can do it, they are genuinely powerful. But for us, right, we don't want to go for that extent. But at least the box split, that is very much needed. एक या दो करो चलेगा. Here is the stomach. When we go for the stomach, these are the sphincters. Sphincter means something which can get closed, right? So we have got 2 sphincters, one cardiac and second is pyloric. Cardiac because it is near to the heart. So that is the cardiac sphincter, right? So this one is cardiac sphincter, and then all the muscles, see, all the longitudinal muscles, and then finally this is the second one, which is called as the pyloric sphincter. So if that pyloric sphincter remains closed, food comes, right? It gets digested, all that good pet mein, right? That is over here. Cardiac sphincter also gets closed, so now it is a closed chamber, and then the contraction starts, digestion starts. Whenever there is any of the belching, vomiting, right? वो जब होती है, so this means that stomach contents, they are going up. Stomach contents, they are going up. Yeah, they don't understand it. Make noise. Just a minute. Just a minute. So that is cardiac sphincter and the pyloric sphincter. Right? These are the big. Yeah, Kunjal, want to ask anything? Go ahead.
Sir, I don't know it's a myth or a fact, but many people tell that not to drink water after a meal. Because like
Absolutely.
water gets absorbed really quick. So we should or we should not.
No, very simple. See, it is not that much complicated. After food, when you drink water, simply what really happens is this gastric juices, right? The gastric acid, hydrochloric acid.
Acidity decreases.
That is, it becomes mild, it becomes neutralized. When it is neutralized, it won't be able to break the proteins and break the carbs that effectively. So unnecessarily, undigested food that will start traveling. So that's why it is said that before you start eating, you can have your food, you can have your drink, you can have your water about half an hour before you start your lunch or dinner. But After you eat anything, at least for an hour, don't eat anything. Don't drink anything. Right? Nothing. Many times they say chai, coffee साथ ले रहे हैं. No, that is not a good thing. Chai पीनी है, coffee पीनी है, तो plain chai, coffee. Don't try to mix it with anything else. Similarly, it is said that when you eat curd, dahi, it is such a good thing, right? But then we mess it with उसके अंदर वो दुनिया भर की चीजें डाल के, right? नहीं, don't mix. And that market का yogurt, वो तो बहुत खराब, because it has got so much of sugar. So just keep that thing in mind. Buttermilk, must. It is superb. Buttermilk can be taken. Good. After cosmetic, it looks so worst. हाँ. अरे cosmetic surgery तो, ऐसी. If I say this statement, it will be like too much. But yes, that is true. That almost everyone in the Hollywood or Bollywood, they have gone under the scalpel. करवाते ही हैं. They are so much obsessed with their nose, so much obsessed with their cheeks, ये वो, अरे everyone. हाँ, कराती हैं.
Sir, in the first, second session, you said the percentage ratio of the body.
Golden
They
ratio.
analyze
Golden
it
ratio.
and just drew in the body which has been created.
हाँ,
Really.
but यार देखो, golden ratio जो है ना, you can manage certain things, but you can't manage everything. अब face के लिए golden ratio is there. There is a golden ratio for face also. But one should not be so obsessed कि बस वो जाके surgery में बैठ गए. Right? No. People nowadays are trying to remove smile lines. Smile lines, उसके बाद वो crow lines, right? आँख के बाजू में जो crow lines, right? They try to remove it. And ये पता है concept कहाँ से आया? ये अपना ये Chinese or Korean serials, where the face is like a glass. So now the trend is like glass skin. मतलब there should not be even a single wrinkle, because that is best. अब this varies. Any one of you who is fan of James Bond, right? I got the entire collection. I must have seen it not less than 20 times. सारे movie देखे, right from the Doctor No to Never Say Never Again, हाँ, right? So many. अब इसके अंदर एक mark करना. Say for example, Sean Connery, right? He was a boxer. Now, if you look at him, or even Roger Moore, right? If everyone, they were having wrinkles, because at that point it was considered as, yes, that is a sexy thing. That is something which is more attractive. And now the trend has gone towards this. So ये तो क्या है कि मतलब trend चलते हैं, and because of this, the Botox industry has increased by not 20%, 20 times. All those who are, say, who are comfortable with shelling about lakh of rupees a year, हर 2 महीने पे जाके बोटॉक्स से इंजेक्शन ले रहे हैं. Previously, it was not that much. Botox was used only in some cases, in clinical cases, but now it is used for more of the cosmetic purpose. कैसे कैसे creams आने शुरू हो गए हैं. मतलब when we see, okay, it is consisting of large amount of hyaluronic acid and this and then vitamin A, K. So then my question comes, then why not to use the retinol directly? Use such creams, but then no, Indian companies, they don't make, and those which are available, they are prohibitively high. The cost is so high. पर अगर जो मैंने बोला कि आप you eat say 5 बादाम, right, 5 अखरोट, right, just overnightly soaked, chia seeds, not that costly, 1 चम्मच chia seed, right, but it will keep the nutrition and the hydration of your body so well, right. Then अपने पालक, spinach, वो इतना अच्छा. Buttermilk, have it. बहुत इच्छा हो कि चलो थोड़ा पैसा स्पेंड करना है, तो then go for the probiotics. If you feel like, I want to go still higher, go for prebiotics. So prebiotics is like that food which you are giving to those bacteria, so that you are telling them that you proliferate and they increase. So all these things, they will make a big difference in your overall beauty. It is not so that ठीक है face भगवान ने अच्छा दे दिया, but rest of the body if it is not powerful तो क्या मतलब? So it is the
But sir,
overall.
what the people take on that fill up injection to the face? What kind of that?
Botox, all those fillers. In the breast, they fill up is silicone. It is called as silicone implants. It's called as silicone implants.
Such more pain, na, sir.
देखो, मतलब all of you are adults and it's okay, but truly speaking, मतलब it is like all those females, those who are with silicone implants ना, मतलब बड़ा I'm telling this thing in a very friendly way. They are like showcase में पड़ी मिठाई. Seriously, right? You are smart enough to understand कि मैं क्या करूँ. It is literally like showcase में पड़ी मिठाई. देख सकते हैं, खा नहीं सकते. बस समझ लो. All those implants and they cost what? They are massively expensive. So all these models and everything, everyone, right, they go for it. But surely it will, and even from the female perspective also, it would really kill those sensations. What's the point in that? Here it is now. Next is number of heads or number of bellies, right? Yes, Jonathan, go ahead.
So regarding the implant, let's say some people do that after they have cancer as well, right?
That is also, yeah, again, it is a cosmetic purpose. Right? So they do it. But again, it is not advisable. Say if we talk about Angelina Jolie, right? She went for this. She went there. It was not cancer. It was suspected that there is cancer. But as a precautionary step, she went for removal of both the breasts. But then there is no implant. Right? The choice is like they can go for the what is called as the padded bra. So that becomes more. After that, she came in so many movies. But all good.
Sir, won't silicone implant cause any damage to the cells or the muscles?
As
Like,
such, when the doctors would say no, it won't cause any damage because it is an inert material, right? But still, the implants which are inside, they are in the form of bags, and it is definitely expected that this bag should not rupture. This bag should not rupture. So you have to tell your patient that these bags, they are for show only, right? And not to be manipulated in any of the harsh way. So that's why.
and then if somehow due to maybe heavy lift or something else it gets ruptured, then it
Ruptured.
may
It
definitely
has to
cause
be
harm.
removed. It has to be removed. Surgically, it has to be removed. Yes.
So how does the person know that it is ruptured then?
Irritation, pain, itching, redness, all those things. Because it tissue which will be
So
reactive.
bruises can also occur.
Bruise won't occur because bruise is like in case if there is some external injury, then it can occur. Why only dermatology medicines charges high than others? Well, dermatology, I mean, I think you are talking about cosmetics, right? Dermatology, you mean cosmetic. Yakult probiotics are Yakult as such ठीक है पर यार Yakult में sugar check करना sugar is so much इतनी ज़्यादा sugar because actually if you make the yogurt by yourself ना those prebiotic wala if you make it by yourself it will be tasting slightly khatta it might not be very tasty but it will be very effective ये क्या है market में they add sugar they add so much of sugar so it kills the whole purpose.
Sir, are whey proteins good?
Whey proteins are good.
Sir, any company you suggest like
I mean, it is expensive. Yes, it is called as the optimum nutrition, but trust me, this is very expensive.
Sir, muscle blaze is good.
Muscle blaze is okay. Is okay. I always keep confusing muscle blaze and muscle tech. Is Muscle Blaze Indian company?
Yes, Indian
Gurgaon
company,
wali?
the orange
Mat
and
lena.
black.
Mat lena. If it is that Gurgaon wali company, I think that is Muscle Blaze. Because Muscle Tech is very good. Muscle Tech is something which is used by some of the Olympic people, right?
Muscle Blaze is not good.
Muscle Blaze नहीं, जो Indian है ना, जो यहाँ गुड़गांव में, I think its factory is in Gurgaon, right?
I think so, yes.
There are several pending cases on them where it is the content is not okay. Advertisement must करते हैं, but when it comes to body और दूसरा कि whenever you buy any of the foreign proteins, you go from the genuine shop, because the amount of money which you are spending and how much you are consuming. Say if you even optimum nutrition on एक डब्बा जो है, it will cost you 10,000 rupees. मतलब
Sir, per kg?
नहीं, 2.2 kg.
Okay, okay.
Right? So that comes to about 4,000, 4,000 रुपए किलो हुआ.
Sir, it's almost like 30% more than Muscle Blaze.
True.
Price.
Constant. हाँ, but the amount of absorbability and the effect, मतलब आप एक डब्बा लीजिए, वो 3 डब्बे खाइए. Comes with 88 servings. That means 3 महीने चला, 3 महीने के लिए 10,000, मतलब आपको महीने का जो है 3,500 रुपए आपने खर्चा. That is every day is 100 rupees, right? But when you start taking it, you'll feel the difference within 3-4 days. The pump which you get, the quality of the muscles, the power which you get, that is very different. So it is like our body, right? No compromise.
Sir, is Necpro a good brand?
Which one?
Necpro.
I don't have much exposure to all the protein companies. But anyway, mail bhejna, I'll just check it out and we'll let you know.
Necpro is the name way gold.
Okay. Korean, Japanese, why people confuse their skin with ours? हाँ, सही बात है. Their genes are like that. Korean और Japanese का तो है ही ऐसा. And then the zero figure. Right? Zero figure. जरा सा भी वजन बढ़ गया तो all those कुछ नहीं. Acha, this is about the belly, right? Here it is, long belly, short belly. So this is our biceps. It has got, so when we say biceps, ये पहले भी बात हुई है, 2 heads, right? Biceps brachii, so it has got 2 heads, long head and short head. And long head, you see all the way it is passing through that groove, and then it goes into the joint.
Intertubercle sulcus.
Yes?
Intertubercle sulcus.
Correct. Intertubercular sulcus.
Or bicipital
groove, na?
Bicipital groove, that is also bicipital groove. And here is on the back side, we have got the triceps, right? Which has got 3 heads. So there is a long head, there is a medial head, there is a lateral head. So thus it has got 3 heads. That's why we call it triceps. Here is the rectus femoris, right? So this is the rectus femoris. This one, big one. It's a straight muscle, right? Rectus femoris is thigh, rectus is straight, so straight muscle of the thigh. And rectus femoris, vastus medialis, intermedius and lateralis combined to form what is called as the quadriceps, right? Quadri means 4, femoris, thighs, right? So it has got 4 heads. Then this is one of the very interesting muscle. This is the hyoid bone, right? The hyoid bone. This one, hyoid bone, and then all the way from sternum. So from sternum to hyoid bone. So this is the hyoid bone, and then there is a thyroid cartilage, which you are watching it over here. This is the thyroid cartilage, right? And then there is a membrane, and it is this hyoid bone during deglutition, upar niche, when you touch and then you swallow, and you will feel up and down. Upar gaya, niche aaya. So this is all controlled by, this is sternohyoid. So very easy, sternum to hyoid bone, right? So sternohyoid. So this is again from the attachment, right? From the attachment. Kahan se kahan? Sternum to hyoid is sternohyoid. When it will be from sternum to thyroid cartilage, so it will be called as sternothyroid. Then from thyroid to hyoid, it will be called as thyrohyoid. Right? Bahut easy now. Location, where to start, from where it is starting, where it is ending. Then this is tibial, this is anterior, right? So tibial bone, which is on the tibial side, right? And it is emerging from the tibial bone. and it is on anterior side. So we are calling it tibialis anterior. Or there must be tibialis posterior. And it is. Then to depress, these are the muscles which we are talking about. Sternohyoid, right? Then sternothyroid. So just name say sternum to thyroid. Thyrohyoid. So from thyroid to hyoid. Clear? Right? And then there is something like omohyoid. Omohyoid, it has got two bellies. So this is one belly. And then there is a tendinous structure. And then there is another belly. So this is what is called as the omohyoid. So these are the infrahyoid muscles.
Sir,
See,
can
when
you
this-
explain omohyoid?
just remember, it is like it has got two belly. This muscle, this is one like this, and then other belly is like this. It is the muscle with two bellies, right? Two muscles combined in one. So over
Like
here, because
aponeurosis, like
huh?
aponeurosis, like
But it is absolutely a cord-like structure in
the
between.
cord tendon. Okay, cord like tendon. Okay.
And over here, if you see what I have written is infrahyoid muscles. Infrahyoid means these are the muscles which are below the hyoid bone. Right? So then there will be something like suprahyoid. Yes,
Supra.
there are. Right? So that would be another set of muscles which will be above. So these infrahyoid muscles will what? नीचे से बैठे, they will pull, they will depress the hyoid bone. So hyoid bone is pulled down. When it is pulled down, so then that esophagus opens. खाना अंदर गया. Right? And then they are released, so then hyoid bone will come back. We go back. Right? So that is when the suprahyoid muscles they will come into picture. Right? So it is a very beautiful orchestra when we are swallowing anything. All time अपना favorite, right? Which we have discussed also. देखने से immediately पता चल गया, this is the spine which we are talking about. Above the spine it is supraspinatus, below the spine it is infraspinatus, and there is a muscle, right? This one marked this. This is the teres minor, right? Teres minor. So teres major, ये इसके नीचे ये बड़ा सा, this one is teres major, right? We are interested in these muscles, that is the supraspinatus, infraspinatus, teres minor, and there is subscapularis. Subscapularis, which will be on the other side. So it is underneath the scapula, and then it is coming like that. So that is subscapularis. These four muscles, they are important. Remember it like SITS, sits, right? This is for, it is called as the rotator cuff muscle. Rotator cuff muscle, so that shoulder is not dislocated. Right? If these muscles are weak, then dislocation of shoulder becomes very common. So that's why its function is stabilize shoulder joint. Right? When they contract, this posterior group contracts, so this moves externally. When subscapulary contracts, so it moves internally. So it is for the medial and the lateral rotation of the arm. That's the whole purpose. But over here, our purpose is above the spine, supra, in below the spine, infraspinatus. Right? Underneath the scapula, subscapularis. Here it is vastus medius, intermedialis, lateral. This is vastus medialis individually, vastus intermedius individually. Then this is vastus lateralis. This is individually. Then comes the structural pattern. Structural pattern, right from, so this is like circular, convergent, parallel, or pinnate, multi-pinnate, bipinnate. Instead, let's see this. It becomes much easier. Here it is, right? See biceps brachii. So we know it has got two. Rectus abdominis. So here they are parallel, right? They are parallel. So rectus abdominis. Triangular, right? From the shape. So pectoralis major, deltoid, etc. Unipinnate. Unipinnate means it is like a leaf. Leaf. Right? In leaf, if we really draw the leaf, right? So we draw the leaf like this. This is this side. It is one pinna. So here, when we see like this is unipinnate. This is unipinnate, this one. This is bipinate, exactly like leaf on both the sides. And then we can have multipinate. Say, for example, deltoid, it is like multipinate. See, as if we have combined several leaves together. And then finally, circular, this is orbicularis oculi, right? Circular. So that's it for today. Right? This
Sir,
is how
pinnate is feather-like structure.
feather-like structure, exactly. It is a
Okay,
feather-like structure or leaf-like structure. Yes.
Sir, exercises.
Yeah, the core muscle exercise.
Core muscles. Yes. Yes. Dekho. This is, I'll draw every step as it is very crucial. Here is you, right? First, stand balanced on both the feet, right? So this is balanced. Next is shift the weight on one side. Shift to one side. Say, for example, right. So now your position would be, as such, it is like this, but on this feet, you are putting more pressure, and this feet is just touching lightly. This is pressure is more over here. So this is the second step. Third step would be interesting. Third step is, and this feet is off the ground. So you are on one leg. And now in this position, go for squat. This is one leg squat.
Sir, it requires very good knee strength, right?
Yes, yes. But the thing is, we don't have to worry about how much deep can we go. नहीं ज्यादा टेंशन नहीं थोड़ा होगा तो भी चलेगा right do it like this balance and then shift onto the other side and then do the balance right even if it is for 2 seconds no problems we are happy but when you do this thing it will generate so much of power
Caught hold on one leg, we can say.
Hold on one leg.
Okay.
Nena, this Cetaphil face wash and vitamin C serum, yeah, that is good. That is good. But they are pretty costly. मिश्री टू द कर्ड जरूर पर वो मिश्री कौन सी वो रॉक जैसी वो रिफाइंड नहीं वो पत्थर जैसी आती है ना वो आई ईट दैट
Sir, and farmer walk is also a good exercise for core,
absolutely, right? Absolutely. Farmer walk is always good. Farmer walk is always good. And then also in the farmer walk, if you can first test that how much weight can you lift, because farmer walk can be done in two ways. You take 2 dumbbells or you take 2 kettlebells and then you keep on both on one side and then you go for walk. Or one thing is what is called as the goblet squat. You hold it and then do the farmer walk, right? And if you want to take it to the next level, with every step you rotate. With every step you rotate and then see what happens.
Okay, the body becomes more unstable, so core muscles have to work more.
Exactly. When the body becomes unstable, so from your brain, the messages will come on, balance the body. So it is also activating your 8th cranial now. So when
the minor muscles also have to work.
Minor muscles also have to work so that they need to go for the better. People who feel acid is due to looseness of sphincter, right? That's right, Hafsa. That's right. That acid when it is
a little, yeah.
Try to avoid that. Try to keep the body straight because the beauty is when you do the squat, that's why the goblet squat. When you are holding it and when you are doing the squat, when the body is straight.
Sir, while barbell squats, I find that my knees go forward. While body weight, it's most of the time just slightly bent towards forward.
To try to go for goblet. It will improve your core and it will improve your posture also.
Okay.
Best is kettlebell. I use kettlebell. So hold the kettlebell from horns, ulta, and then hold it and then do it.
Sir, being overweight also, I think, is a reason which it is occurring.
Bilkul. If anyone is overweight, sure, it affects.
Yeah, maybe. Maybe that's the reason more than the barbell squats.
Flex a digit minimum hai na. All right. So see you next time. Right. Take care and
Thank you, sir.
Thank you, sir.
Thank you, sir.
solve के ये Amazon वाला problem
Thank
solve
you so much.
okay see you bye bye